Senator Chiranke.
Thank you, Mr. Speaker. I'm disappointed because most of the senators who were saying SHA is not working, like Senator Omogeni, are not here, including Senator Sifuna, but they are quick to yap in funerals that it's not working. Mine, Waziri Duale, is a very simple question. One, you want to ensure USC succeeds. What can you tell Kenyans that today SHA is working, and in terms of improvement of personnel that work within the value chain or the chain of universal care? Waziri, you and me know that there was a presidential directive, and I know the biggest obstacle has been COG on the issue of confirmation of universal health coverage staff that have been on contract. But I'm happy, through your guidance as the CS of health, the SRC has harmonized their pay slips. What is the status in transiting these UHC staff to permanent and pensionable so that we make SHA works? And Waziri, can you use this forum to tell the naysayers and doomsayers, including Senator of Muranga, that SHA is working? Mr. Speaker, I find it painful that many people out there are quick to say SHA is not working, yet they cannot come and ask the gracious CS. And I want to thank CS Waziri Duale, because he's the only CS that has always appeared religiously before this house. Unlike other CSs, I don't want to mention names, Mr. Speaker, because I will be accused of playing politics. But I know how to play it somewhere outside there, Mr. Speaker, not in funerals, but in birthday parties. I thank you, Mr. Speaker.
Senator Essie Okanyuri.
Thank you, Mr. Speaker. Whatever I wanted to ask was on the issue of UHC staff, which Senator Chiranke has already highlighted.
Senator Boni, Khalwale.
Thank you, Mr. Speaker.
Yes.
I have listened in this House to the Minister and also in the media. When he speaks to SHA, he speaks to two cardinal issues: the success of registration and the challenges in the reimbursements. But in health delivery, the real issue is service. Up to now, St. Mary's Hospital is closed. Colleagues here, they want to play to the gallery to say, you want me to say,
Senator Boni,
can you contain him?
Address the chair. Senator Fernandi, allow Senator Boni to make his point. Allow the Honorable Senator to make his point.
Thank you, Mr. Speaker. And therefore, when hospitals served by some of my colleagues and owned by some of them are owed 43 billion shillings by SHA, and NHIF is still claiming 33 billion shillings, how do you expect a clear-minded scientist like myself to say it is working? Anyway, Mr. Speaker, I want, with your indulgence, to allow me to ask the Minister, you have a chance to clarify today. What interest does the chairman of SHA have in the so-called Metro group of companies, in the so-called Metropolitan Hospital and...
Mr. Speaker, I want to thank the Minister for finding time and to respond to very important issues. Secondly, I want to appreciate that this is a very intelligent conversation, listening to senators raise issues pertaining to their constituents, particularly on this very topical matter of social health insurance, because it involves the people that give us a mandate to come to this House, Mr. Speaker. And it's very enlightening. Mr. Speaker, you know, sometimes I get very disappointed, and unfortunately, some of those people that I see in this House sometimes shout in funerals and rallies that SHA is not working. When the Minister is before us now, instead of, you know, it is allowed for a village blogger to say those kind of things, but not for a member of parliament, because you have the opportunity to ask the Minister questions like members are doing this morning on issues which the citizens are facing with SHA. I wish some of those colleagues were here this morning. Be that as it may, Mr. Speaker, I want to ask the Minister, particularly on Section 42 of this Act. You know, this act, Mr. Speaker, is very dear to us as Senate. Mr. Minister, you may not be aware, but we passed the social health laws, all the 4 of them, in the sweltering heats of Turkana. 4 days of extreme work, and therefore we understand this law fairly well, and that's why we continue to demand that it must work for our people the way we envisioned. Mr. Speaker, Section 42 of that law, Parliament demanded that at the end of 3 months, actually the wording is within 3 months at the end of a financial year, Parliament is supposed to receive a report from the Minister on the operations of Social Health Authority. I want the Minister to confirm to the House that in that report that he shall be sending, or perhaps even if possible, Mr. Speaker, he can send a partial report to this House on 3 items that are very important to us as a House. Number 1 is on the spread of county compensation to the health facilities, county by county, so that we are able to know how much in compensation to public health facilities has gone to specific counties, Mr. Speaker. And I explained yesterday on the floor of this House why that is important. And I want that to be sent because I think it was Senator Mogenio who I had him say on the floor yesterday that SHA is not working. So I want to see if there's any compensation that is going to Nyamira County, as well as all the other counties. Why I want this to be published, Mr. Speaker, is so that we are able to know if our citizens are accessing the services that they are being paid for, because those are the people that sent us to this House. And this is something that I have asked the Minister, including in our private conversation. The second thing that must feature in that report, Mr. Minister, is the penalties that you have referred to and said that there are members of staff of SHA that are about to be taken to court because of issues of fraud. If there is something that can bring down this very noble initiative, Mr. Speaker, it is fraud. And therefore it will be important for Parliament to be appraised on how this system has been able to detect fraud, who are the officers that were involved, including the professionals like the doctors and the nurses and the people that you've said aid and abet this crime, Mr. Speaker, so that we are able to read out a list and know that there is a Dr. XYZ who works in Hospital Z in County Y, and this is what they attempted to do, and for that reason, they've been bad and they've been taken to prison, because that is where they belong. Because, Mr. Speaker, we moved the amendments. When this law came to Parliament, in conclusion, Mr. Speaker, I know I've taken long, but let me just make the final remark about it, Mr. Speaker. When this law came before the House, the penalty that had been prescribed, just like all laws that come from the AG's office, was just 1 million shillings. But we moved actually that fine from 1 million to 20 million Kenya shillings, Mr. Speaker, because it was in the best interest of the people of Kenya that anybody who tries to cheat the system is punished by law so that we can save and help these facilities. Therefore, on that account, Mr. Speaker, I expect that the Minister will give us a report of all the fraud that has been detected, the people that have been involved, not just the facilities alone, but the personnel as well that are doing this fraud. The last thing, Mr. Speaker, I am concerned on the rate of rejected claims, particularly in the county that I represent in this House. I was at a public event in a place called Kapkatet a few weeks ago, and the citizens raised concern with me and said, Senator, of all the claims that we have filed, almost 50% are being rejected. What is it that SHA expects of us as a health facility to do? Therefore, Minister, you must tell us as a House, including your officers, to offer subsequent or sufficient training, Mr. Speaker, to health facilities so that they don't provide the service and those claims are rejected. Because at the end of the day, particularly for public health institutions, Mr. Speaker, service has already been rendered and we don't want to sink them in debt. I thank you, Mr. Speaker.
Senator Shakil Abdallah.
Thank you, Mr. Speaker. Mr. Speaker, Ministry, we know since SHA came, there are a lot of challenges, and that is being said, it's working, but my one area which I'm concerned is the lack of clarity on the benefits of the coverage, which is a big confusion to the people at the ground. Because people go to seek services and they are told to pay, sometimes they don't get the services. So I am not sure whether the ministry, I know they did public participation and things. But did the ministry, or is the ministry in the position to do this clarification to the people at the ground to know what level pays for what, so that this confusion can stop? Because this hullabaloo cry of SHA not working, it's because of lack of clarity to the people, like SHA is paying for what, where. That clarity is not there, and this confusion is really because people go for services and they don't get the services due to this confusion. So please, if the minister can tell us, how do they intend to handle this problem, which is really persisting in the ground? Thank you, Mr. Speaker.
Senator Karungo.
Thank you very much, Mr. Speaker. As I ask my question, it's also good for the good CS to note that when we ask questions for the benefit of the House and the public. So whether a senator is here or not here, just like Senator Ojienda is not in the House and he is answering. So when Senator Medu is not in,
and that's why
we are here listening. Okay, thank you. I just wanted to bring that. Thank you. But in a rare support to the CS from me, Mr. Speaker, I would want to tell Senator Khalwale to stop reading Wamatangi Times and instead read the Kiambu People Times. Because for the last 150 days, Kiambu people have suffered because of the strike by the doctors, which took the Ministry of Health and the Council of Governors to assist. And now I can tell you the doctors are back to work. And I told the Senate, I have statements, I have even pushed the Committee on Devolution, and nobody acted on that issue when it comes to matters Kiambu. So I thank the CS and his ministry and the Council of Governors. The Kiambu people now are okay. But I have a question to you, Bwana CS, because you have mentioned it twice now, that you're going to release the data or the statistics on matters Kiambu maternal mortality. I think you should publish that and publish for all the counties, Bwana CS, because I believe with that information, you'll help the Senate to oversight, take our oversight mandate well, Bwana CS. And finally, Mr. Speaker, some counties are not using SHA. They're charging cash because probably SHA is not remitting on time. So they refuse to admit them and they charge cash instead. So I would also urge the CAs to publish the SHA absorptions per county vis-a-vis the registration. Because you might have the number one in registration, yet when it comes to absorbing, you're the last. So I think you should also publish that to help the Senate take our oversight mandate. Thank you very much.
Senator Kathuri.
Thank you, Honorable Speaker, for giving this opportunity also to ask a supplementary question. But before I do that, Honorable Speaker, let me really commend the CS and his team. For this time, we are able to understand what is SHA, what is Linda Mama, between Linda Mama and Linda Jamii, Mr. Speaker. For the first time, CS and your team, led by your peers, Dr. Ruga and Mary Mudhoni, and also now the SHA CEO, Masi Mwangangi. Kenyans are able now to know exactly what is happening. And I wish you didn't mention Waziri Duale. You know, the course you need at the university was not medicine, but the way you're explaining the SHA and the health systems in Kenya, you are doing better that you are putting across Senator Waziri Duale. But Duale, private hospitals and fee-based hospitals. Still, there is a problem because of that billion also amount that they are owned. And they are not able nowadays to treat. Most of them, they are demanding cash. We want to move from cash to universal health coverage. So what is your ministry doing to ensure that you are in good books with the private hospitals and the fee-based hospitals? Because like where I come from, most of the public hospitals are not functional. But most of the citizens, most of the people from Meru County use the fee-based and private hospitals. So there is a challenge because they are not getting the health care that we need to give them. So, Mr. CS, you can give a brief on what is happening and what you're intending to do with those type of hospitals. I thank you.
Senator for Taita Taveta County.
Thank you, Mr. Speaker, for this opportunity to seek for clarification. Firstly, I've had Senator Cheriot speak about hospitals that have not been refunded their claims. And I thought that before treatment, there is pre-authorization. So maybe it seems that like there is treatment before authorization. So I'd like to know which type of maladies or which situations require that there is pre-authorization and which ones don't require pre-authorization. But that was not my point. I'm just riding on Senator Cheriot's question. But my question is about payment for SHA. If I register for SHA and I pay, and after 4 months I get sick, and I go to a health facility, I'm required to pay upfront for 1 year. Why is it so? And yet I'm up to date. And then you've also talked about Lipa Pole Pole, SHA Lipa Pole Pole. When do I access it? Do I access it immediately I register? So that I go for SHA Lipa Pole Pole so that I pay for the whole year? And if I'm sick after, let's say, 5 months, am I still required to pay for a whole year? I think that is the clarity I would want. And finally, Mr. Speaker, what is the interest rate for this Lipa Pole Pole for SHA? Thank you, Mr. Speaker.
All right, thank you. Honorable Chute Mohammed.
Thank you very much, Honorable Speaker. Let me first of all take this opportunity to thank the CS for the hard work he's doing. And congratulations, na asante sana, on behalf of the people of Kenya and Marsabit also. Secondly, the issue of employees, former employees of NHIF. Some employees from Marsabit asked me to ask the CS if they are not going to be absorbed by SHA, the best they can do is go and join other departments in the government. If they join that department, the salary they were earning before and the new place they are going to go to, the difference is huge. Remember, they've borrowed money for their houses before. They've borrowed for their cars. If they go to the smaller salary, they cannot afford to pay those installments. As Minister, what are you going to do to absorb those guys, the employees, former employees of NHIF, under the same employment and salary terms? Thank you.
Senator Mariam.
Thank you, Mr. Speaker, for giving me this opportunity. Mr. Speaker, my question is about the SHA claim, which the majority leader has a detail of it, but let me just frame it differently. Mr. Speaker, the CS explained that they have a digital oversight over their claim that can differentiate between, can dictate the normal and abnormal one. Mr. Speaker, when we went to county visit, almost 23 facilities, most of them, they claim of about rejected claim. So why is it that this rejected claim, and if you have this system can detect the normal and abnormal, see, you have to give the counties a leeway that they can do their parts so that at least they can get this rejected claim. Thank you.
Senator Mogo. Recha.
Thank you, CS, for explaining clearly
the operations of SHA and the system in health sector. My question is, how can the ministry guard against governors that are killing the public side of medical practice, that is the hospitals, public hospitals, because they have theirs in town, so that people go to theirs in town and the government side is dead?
Senator Veronica Ndoti.
Yeah. Thank you, Honorable Speaker, and thank you, CS, for what you have explained to the House. We reviewed the answer to get the detail of it, and I'm sure you have dealt with maternal and infant mortality late, especially because we have been alarmed by what we have seen in Kiambu Hospital. We hope that case is on your desk. Going to the SHA, our phones as leaders have become the backstopping of where patients, when they go to hospitals, the frequently asked questions are actually coming to members of parliament and senators, as opposed to those questions going to SHA. What is the ministry doing to ensure that when patients go to hospitals, seek for emergency treatment in hospitals, they are quickly attended to without requirement for them to pay? And how are you ensuring that anybody who is in an emergency wing of a hospital, public hospital right now, and cannot be attended to because the hospital is insisting that they have not been paid the SHA claims, how are you ensuring they are given support and they are attended to so that they don't have to suffer the consequences of those unnecessary conversations on emergency units when patients need to be treated? Is there any support in that communication and supporting the patient to get access to the health services?